Hello NPHIC members, this is Kerry Shearer for the National Public Health Information Coalition, and we are here in Dallas, Texas on the first day of the big 2013 NACCHO Annual Conference. Now registration is complete. Hundreds and hundreds of public health officials are attending this year's event.
Well, we're anticipating an attendance this year of about 900. Most of them are in leadership roles at local health departments, either at the county or city level. Many of them are health officers or assistant health officers, which are the top management of those health departments. They come to NACCHO conference for a variety of issues. One of the things they look for is the breakout sessions, of course, which offer cutting-edge, programmatic types of looks at some of the more up-and-coming things that we need to be worried about, like the social determinants of health, or how the built environment will affect the community's health, or what do we do about funding and resources and workforce development and finding skilled public health workers going forward from now. Another thing that they do come for are our workshops, where they can actually get hands-on experience working on some of the tools that are out there and that they could take home to use in their health departments. Certainly the exhibitors and the sponsors offer them an opportunity to look at what's out there for products. The university partners show them what is possible for workforce training and ongoing education. And last but certainly not least is the opportunity to network with their peers from other states who are facing similar and yet different challenges, and who can give them ideas, and they kind of cross-pollinate each other and take some of those ideas back home and see if they might not work in their own health departments.
Now there are a lot of workshops underway, including a fantastic CIRC training workshop that is being led by CDC's Dr. Barbara Reynolds. I had a chance to sit down with her and talk a bit about the importance of risk communication and knowing how to effectively communicate to the public when the unthinkable happens.
Research shows us that in any population, about 50% of us are going to be involved in our lifetimes in a traumatic event. So sometimes we focus on the big events and think that public health officials need to be prepared for catastrophic events. But the fact is, local health officials often are involved in events that feel like big events for their community, and being able to talk to the public when the unthinkable happens to that community is really important, and that's what we're investigating today through this conference. We talk about the fact that it seems like crisis events, either natural or man-made events, are increasing in the pace, and there's some evidence that these things are increasing, but there's also evidence that no matter what we do, big or small, that it's scrutinized more because we have so many different channels of communication, so many different ways for people to get information. So it's sort of chaotic just in that respect. Even if it isn't the worst event in the world, the fact is that there's a lot of pressure on public health officials from their populations and communities around them, wanting to know what's going on, what do we need to protect ourselves from, and what can we do to help. Crisis and emergency risk communication is a relatively new field, but what I see it serves is the opportunity to get the right message through the right person at the right time.
Another very popular session here is a workshop that is being led by Chuck Alexander, and it's about using storytelling to develop strong, effective public health messages.
So often we are focused on big, broad messages, and what we really encourage people to do is to bring with those messages the impact in communities. What's happening at the local level, and that's best told through the impact that our activities in public health are having on individuals. So we stress storytelling. We stress the fact that people are going to be more influenced, be more in touch, and messages will resonate more with people if you're transferring those messages and communicating those messages in a way that really resonates with what they do locally and their experiences every day in life. I think it's about going out in the community and chronicling your activities, taking notes along the way as a public information officer, taking pictures, talking to your program people, trying to pull in information from them about who it is they really worked with at the local level, in neighborhoods, in cities, in towns. Who's the parent that they worked with? What sort of kids did they have an impact on? Did they work with teachers in a community? Storytelling really resonates with who we are. Storytelling gives us an opportunity to connect ourselves and our own experiences to what we're hearing about. And so we need that. We need, as a public health community, to talk about what we're doing to improve people's lives.
And that is just some of what's going on. I'm going to have more for you in tomorrow's update. But in the meantime, a reminder, do not hesitate. Do not forget to tune in to our live webcast from the NPHIC booth. It's this Thursday, the 11th. It's going to be at 11 a.m. Pacific time, 1 p.m. Central, 2 p.m. Eastern time. We're going to have some great guests going live from the NPHIC booth. Just go to live.nphic.org and it's going to pop you right onto the live page. Until then, for Laura Espino and Bill Walker and the entire NPHIC team, I'm Kerry Shearer at the 2013 NACCHO Annual Conference in Dallas.